Thank you for joining us for our first ever End-of-Life Tech for Healthcare. My name is Michael Hebb, and I'm here with my dear friend and partner in many crimes and many good things as well, Dr. Silvia Perez-Protto.
Hi, welcome everyone. I hope this is an inspiring session that we are holding today.
Thank you.
So tell us something about the end-of-life platform that you have created.
Great. I would love to. I'm gonna, so I will give a little background to EOL, but first I'm gonna have you say hi to, would you say hi to our special guests today? So we have Amelia from Saga, and Cody
Thank you so much.
Oh yeah, there she is, okay. And Cody is here from Trust and Will.
Pleasure to be here.
And Fernando is here from MIDEO, or MIDEO.
Hi Mike, thanks for having me.
Absolutely. Get us the right pronunciation on MIDEO. Is it MIDEO? Did I get it right?
MIDEO, yep.
MIDEO. And Fernando has given us the permission to call him Fred.
Absolutely.
So before we do jump into hearing from Amelia and Cody and Fernando and their incredible platforms that they've built and launched, I just wanted to give a quick background on this session, these town halls. They will be monthly, and the idea is very, very simple. Both Sylvia and I have spent a lot of time working with people close to the end of their life and around planning. Sylvia much more from a clinician side. And we've realized that there are incredible tools, apps, websites, platforms that come online. You know, it feels like there's several new ones every week. And we know that frontline clinicians, people that work in the space, are more overwhelmed than ever. And keeping up with what are the tools that can make our lives better, that can make our patients' lives better, that can make our health systems lives better is hard work. And so what we wanted to do monthly is just grab a few incredible organizations, a few founders, and have them tell us about the work that they're doing so that you can now have that in your toolkit as a clinician. And so that's what these town halls are going to be, and they'll be very simple, and we'll have 3 founders each time. But before we jump in to learn from our esteemed guests, Sylvia, tell me what it's been like being at the Cleveland Clinic as an anesthesiologist, but also being the director of the End of Life Center. What has it been like during these pretty historic times?
So we have been working for almost 5 years in order to improve the care of patients at the end of life, to respect patients' preferences, to improve the family experience, and also support the caregivers taking care of these patients that is very stressful. So now with this COVID pandemic, the big problem was not having the families with the patients as usual. So I think technology has been crucial for us in order to connect with the families, make the connections with patients when they were in the hospital. And now that the visitation is better, like there's only one person, still one person. So when there are like 4 or 5 people that wants to visit, it's very difficult. And technology has been crucial for us to maintain the connections. So I'm very excited about all these possibilities that we can share with our patients and families.
Awesome.
So what do you think we can use this end-of-life platform as a physician? I am very excited to be able to show it and share it with our patients. So how do you envision to use this platform as providers? How do you think the end of life is going to be helping us to do this?
Well, one, thank you for everything that you've been doing at the Cleveland Clinic and as an inspiration to providers everywhere. It's been extraordinary work. Silvia and I had an opportunity to create the healthcare edition of Death Over Dinner together with Cleveland Clinic as our primary partner. And we've been at dozens of dinners together and watched clinicians do a deep dive into this work and see it be transformative. And so to be such an incredible leader and open to having conversations about the big D word, which is still a rarity in healthcare, but it's becoming more and more of an accepted phenomenon. So Silvia's asking about our new platform, which you are all now members of, which is eol.community. And it's a free resource, and it's the first marketplace for end-of-life providers, probably the largest collection of content and wisdom, and an incredible resource of leaders that are there to help people. And actually, before we jump in with Amelia, Fernando, and Cody, I'll just show a short video about EOL, which will really answer some of those questions. But how I see EOL helping clinicians is that it is something that you can prescribe to families. It is something that you can, that will help take some of the burden off of clinicians themselves, get them prepared, whether before they come to you or whether you're working with them as a doula or as a palliative care doctor, a nurse, a chaplain, et cetera. So I'm gonna go ahead and share screen and share this very simple video. It's just a couple minutes long, and then we'll jump in and learn about these incredible platforms. Life is a journey. There is a beginning, middle, and an end, with some exciting mishaps and adventures along the way. And yes, every journey has a final chapter. The final chapter of our life and the lives of our loved ones is filled with many challenges, many decisions, questions about wills and advanced care directives, memorials, and quality of life. For the last 8 years, we have been talking to people about their end-of-life wishes, a lot of people, sparking over 1 million conversations, talking to the young, the old, and the in-between. We learned a lot, and a light bulb went off in our head. What if there was a beautiful, welcoming place to go that would turn this task of thinking about the future into something engaging and meaningful? A place that could help us feel calm, a place where we were not alone. At the End of Life Collective, which we affectionately call EOL, we have gathered hundreds of the best caregivers and service providers together in one place. We built a community of the most knowledgeable end-of-life teachers and guides. We built simple tools so you and your family can create a complete plan, all in one place. And we made it free and available to everyone. On EOL, you will find service providers to help you with financial and legal planning for wills and trusts and medical documentation. You can explore insurance options and find the best in later stage living. We will help you if you're in the middle of a difficult time and are looking for memory care or the most trusted hospice and palliative care options. Maybe you are planning for a funeral or are interested in green burial, or perhaps you are struggling with grief. You will find a community ready to help you with all of these things. And most importantly, EOL is focused on wellness. We are committed to helping people live the best lives possible, even in the hardest of times. At RoundGlass, we strongly believe that the last chapter of our life, even if it is very far off, has so much to teach us, so many gifts to give. EOL is a place to gather together and plan for life's last chapter. This is the very beginning of this new adventure. Take a peek and let us know if you like what you see. All right. Oh, I don't know what that
is. Setting the mood, Michael.
A little Kenny G for your listening pleasure. Amazing. Well, with that kind of romantic interlude, I'm going to turn it over to Cody. Somebody feels like she needs some wine. That's Patty Burgess. Hi, Patty. Hi, all of you. I would love to know where people are coming in from. But we're going to turn it over to Cody. Cody has been a very impactful entrepreneur for a long time. And to have him turn and to think about the end-of-life planning experience, and specifically around wills and trusts and this paperwork that vexes so many of us and has for so long, and to simplify it, to clarify it, to give it a clear pricing structure, like so many things, and with elegance and grace. I'm thrilled to have people learn about Trust and Will. So Cody, I'm just gonna turn it over to you. You know how to tell people about this product. Thrilled that you're here.
Yeah, thank you so much, Michael. And thanks everyone for tuning in from all over the country. And it looks like some folks up in Canada as well. Really, really excited to be here today. I've been an entrepreneur for the last decade, and this is my third company. And my reason for getting into TrustMall is for the very obvious. It's the fact that I am a husband, I'm a father. Both my business partners are also new dads. And the time in life that most people start to think about estate planning usually is after they have children or buy their first home. But it's pretty profound, the fact that half the population does not have an estate plan, that the average estate plan costs $3,000 to $5,000. It's not inclusive. It's a high barrier of education. And we really set out from the beginning to go build the TurboTax of estate planning. TurboTax services 35 million Americans' tax needs every year. Why couldn't we go build the same for estate planning? So for the last 3 years, TrustMall has raised $8 million in venture capital. We've helped 138,000 families across the country. We're live nationwide. One thing that's very innovative and unique to us is we completed the first electronic will in US history. That was first in the state of Nevada, currently live in the state of Florida. So digital signature, digital notary, digital storage of the documents. And we have an industry-leading 5-star customer experience that I'm really proud of and happy to show you what that looks like. Now, we think far beyond documents, right, the surface level, and that estate planning really is the transfer of wealth and assets. And over $1 trillion in assets is passing between generations every single year. And for all of time, this industry has been fragmented. It's been expensive. And for many families, it's emotional. Most families have a stigma of estate planning because of probate. The family member or loved one didn't have an estate plan. There was communication errors and distributions that were not properly shared with the family. And this is what ultimately tears families apart. So we set up from the beginning to make TrustMall the hub of the estate management, from the creation of the documents to the management of the estate, all the way through distribution as we build our company over time. So we started with documents. This is the obvious. The 2 products that most people come to us for, the given in our name. We have our will-based estate plan, which includes the last will and testament, HIP authorization, advanced care directive, power of attorney. And then for the homeowner, the wealth builder, and for those who want to avoid probate, we have our trust-based estate plan. It's a revocable living trust. This is what most attorneys will set you up with. Now, one of the things that I love is that we've made estate planning simple, affordable, inclusive for all. We have a brand that resonates with consumers. It's inclusive. We layer on top of that brand a 5-star customer support experience. We have an attorney-led team. We have live chat support. You can book a phone call with our team. We are everywhere and anywhere that our customers can have a conversation with us. And that starts from the first time you hit our website. So when you come to trustmall.com, you are immediately exposed to our live chat support. These are all members of our team in San Diego, California, so we don't outsource or offshore this. We also make estate planning approachable. Some people don't know where to start, so we like to have them start with a quick quiz, and that quiz will funnel them into one of our 3 products. But from here, it's very much that TurboTax-like flow. You're filling out information about yourself, your family, guardians to your children and pets, going through and cataloging your assets, leaving money to a charity, all the way through your final arrangements. And with the sustainable movement around death, we feel there's some incredible opportunities for us to introduce people to alternative sustainable burials and cremation processes. All we're trying to do is get our members through the process as easily and as educated and informed as possible. So we have live chat support. We have our resource center with all this wonderful content, the ability to chat with our team. All your information is auto-saved throughout. And of course, you can come back at any time to finish at your own. But what we're doing is getting you to a set of custom documents, and these are all state specific. If you ever need to make a change to your trust documents, will, your healthcare docs, you jump right back into that specific section. And once you've finished with us, that's when we're shipping out our documents. We have a beautiful packaging. We do all our fulfillment in-house. We ship out next day, get to people's doorsteps within the week for them to finish with signature, notary, and witnesses. And one thing that's very unique to our business that's currently live in 2 states, but many more to come, in Nevada and Florida, and then in a few more states before the end of the year, you can do a digital execution of the estate plan. So you do a video call with a notary, you get digital signature, do a digital notary stamp, and then the documents are stored digitally, and any updates you need to make are that way. This is the future of our business. It's the timing of why we started TrustMall. And we're able to work with some incredible partners across financial services, insurance, nonprofits, with many more in the pipeline. Specific to this audience, one thing that we are incredibly proud of is that as the pandemic unfolded, we saw articles coming out on CNN and Fox, every major publication, that medical professionals were going to estate planning attorneys in droves, trying to get their estate plan set up out of fear, anxiety. That's not something they should have had on the top of their mind or the back of their head as they're helping our family and friends. So this is updated to reflect the current language, but basically for the last 6 months, we offered a free will-based estate plan to healthcare professionals across the United States, and over 11,000 of them opted in. It was about $2 million in revenue that we would have captured that we foregoed in the way that we wanted to help our heroes. My wife works in the hospital, my co-founder's wife does as well, so this hit kind of close to home. And even though we're 6 months into this pandemic, we're still offering an exclusive discount to healthcare professionals as well as teachers now through verification. So incredibly proud of what we've accomplished, but more importantly, where we're headed. We have an opportunity here to impact the lives of tens of millions of families, but more importantly, their legacy and who protects their children and how their assets flow to the next generation. So to be here to share this with you today truly is an honor. And with that said, I want to pass along to our next guest, Amelia Lin, the co-founder and CEO of Saga.
Awesome. All right. Thank you so much for the pass off, Cody. I'm excited to be here today, and shout out to everybody who's tuned in. Just really grateful. Okay. Cool. So I'm Amelia. I'm the CEO and co-founder of Saga, and we make an app that helps families save the life stories and memories of loved ones in their voice forever. So if you've ever known anybody who's saved a voicemail for mom for many, many years, that's what we do. We make it really easy, and we try to solve that problem of having something more than just that voicemail. And the problem that we're trying to solve is that despite the fact that today's retirees actually rate the importance of passing on life lessons as twice as important as passing on physical assets like money, there's no good way to pass on some of these incredible memories and personal legacies that people have. And this comes from a very, very personal place for me. I started Saga in large part for my own family. It was something that I had wanted from my own parents for a very, very long time. For something like 10 years, I had begged my mom and dad to find some way of recording for me these incredible stories they used to tell me and my little sister when we were growing up about how they met, their childhoods in China, why they came to the United States, what was it like for them when they were new parents. And every time I brought this up to them, they'd say, well, Amelia, we're very, very flattered. That's very sweet of you. Maybe when we retire, because that sounds like an awful lot of work, writing a book about our lives. And so the goal for me was, I wanted us to build something that would, one, make it really easy for people like my mom and my dad to record these things for me. Two, something that would feel fun and not like a big chore. And three, and most importantly, especially right now, I want it to be something that we could do from anywhere, because I'm calling from California, my family's in Texas. And so I want it to be something we could do from afar, no matter where we were all living. And so this is why we built Saga. So I'll tell you just real kind of high level how it works, but what we do is we send you and your family question prompts, and they're things like, what's the biggest trouble you got into when you were a kid? Who was your best friend when you were growing up? How did you meet them? There are these prompts, these conversation starters that are really meant to prompt memories. And then you can record in a number of different ways. So we've made it really easy for anyone to use. Of course, you can use the app, but you can record even without the app by dialing into a special phone number that we give you. So you don't need a smartphone. You can even do it from a landline. We also additionally have a feature that even lets you, from the app, call somebody and ring their phone as well, so that all they have to do is pick up and you can interview them live. So we've really tried to make it very easy for anyone to take part. And this is also supported internationally. So if you have far-flung family in other countries, they can take part in this too. The real magic for us, I would say, is it's actually about the connection between people. I think that's really where the magic of our product is. We do make it very easy for anybody to take part in this, but what happens is that as these recordings are saved and shared privately with your family everywhere, which is honestly, it's a lot like getting a personal private podcast from your family and getting to hear their voices. It's kind of what it's like. You can comment and post pictures and react to each other's recordings. And so no matter where you are and no matter how far apart you are, especially right now, it's just a wonderful way to not only stay close, but to grow closer and actually learn new things about some of the people who are most meaningful to you as well. And particularly for this audience, one of the things that we do with partners is that we can create these custom question packs. So for example, if you know that you or the families you work with or your clients, you would want to custom choose a couple of specific questions, recommend them to get started with it. Sometimes people even have a specific set of custom questions they want to use with their own clients or patients. Then we can create these custom question packs, and we also give discounts on our paid plan, which has unlimited storage. So you can see, so this is just showing one of our partners, Japanese American Memorial Pilgrimages, who has been storing the stories and memories of Japanese Americans who lived through incarceration in World War II, and they sort of created a custom question pack with us for their members. And we're just, we're super, super grateful for the incredible support that we've gotten from the community. I see in the audience, I think we've got some people even from Endwell. We're so grateful. We were very fortunate to receive the Innovator Award earlier this year through one of their competitions. Been featured in places like Forbes and CNET. I think particularly because of COVID right now, and people kind of knowing this is something really important, and of course are very grateful to have been supported by many of our investors and our backers as well. And that's it for me. So I just wanted to say you can check us out at trysaga.com. You can certainly contact me directly. And thank you so much for giving us the chance to join today.
Thank you, Amelia. The emotional impact of this app, that is almost seems like an oxymoron, that an app can have such powerful emotional impact, but it gives me an incredible amount of hope that technology is moving in the right direction. And I think I echo everybody's sentiments that we all wish we had this for all of the people that we've lost. I know it would be the thing that we would refer to and listen to and delve back into. So we're going to turn over to Dr. Fernando Mariachi, whose name I probably just butchered, but I'm trying so hard. Fernando has been a leader in the healthcare space for a long time and has really created a sea change, I think, in how we can think about advanced care directives. So I'll let you take it away, Doctor.
Sounds good. I'm going to share screen here. All right, so I'm Fred Maraki. I'm an emergency medicine physician. So you're going to hear some medical garb and essentially what's happening in the space and how we can make people safer as far as they traverse through advanced care planning in wellness as well as end of life. So mostly I want everybody to realize that this is a triad effects that keep occurring. And the center of that triad is essentially the patient, you. And everybody has a role in you. Everybody has a say in you, so to speak. There's a payer, there's a family member, there's a provider. And with MIDEO, I think we have an opportunity here to provide a lot of clarity, a lot of confidence, and a lot of comfort to make sure that you're traversing through the healthcare system safely. So with that, I'm going to use about 90 seconds here to show you what we do.
Today, critically ill patients of all ages who can't speak for themselves present in a medical crisis with a living will or pulsed. How will you know this patient's wishes? Will you save this life or let them die naturally? When seconds count, paper documents aren't practical. Physicians need to hear from the patient or appointed agent in specific terms they understand. Physicians should not have to guess the intentions of the patient they just met from a piece of paper. This places both the patient at risk and is a new malpractice risk to physicians. Patients come in with no one or information other than vague documents. Do you even trust the document was created correctly? How will you know if the patient you've just met wants to live or is ready to die? When seconds count, you can now hear from the patient or their healthcare agent rather than interpreting paper, minimizing risk to patient safety and malpractice risk to you. Recommend or look for MIDEO, My Informed Decisions on Video. MIDEO is an ID card kept with a driver's license and insurance cards. MIDEO is backed with over 15 years of research and development and keeps both patients and physicians safe. It contains all the information that doctors need in the specific terms you need in seconds. Scan the code with any smartphone and within seconds, watch the patient's MIDEO safety statement, preventing medical errors. Visit MIDEOcard.com for more details. The process is simple, and we guide patients through it. MIDEO is peace of mind for the physician and keeps patients and families safe.
So that's what I think it comes down to. It's about keeping people safe as you traverse again through wellness, serious illness, end of life, no matter what it is. And I'll tell you here today that I've done these mistakes. I've overtreated people, I've undertreated people. And it's something that sticks with you, and you always try and figure out how to not do it again to make sure people are taken care of. So again, it's a safety problem. We're going to talk about patients, we're going to talk about families, payers, providers, you name it. But first and foremost, end-of-life wishes aren't really being heard. And if they're being heard, they're not being honored because people don't know what to do with them. And it's resulting in medical errors in your care. End-of-life discussions are occurring, but not to the level that they need to occur. And if they are occurring, they can often be biased. They're not really portrayed, and it depends on how the individual was trained and how they actually present that information to you. So it results in both unwanted treatments or not receiving treatment that you thought you would get, and what we call is discordant care. Oftentimes, patients are unaware of advance directives, the need for them, or they're thinking it's just for end of life. And the typical advanced care planning documents, the living wills and the pulse documents and so on, they don't really have good clarity as far as to drive that final decision when it's end of life or if it's end of life. Oftentimes we have to determine, is this critical illness versus end of life, and do we enact these forms or not? And then individuals could be snowbirding, they could be working, they could be living in different areas, and they could require different forms for each state because a number of states, the providers just won't honor the forms that are from another state. So for families, the safety problem becomes such that advanced care planning documents don't get utilized because they're incomplete. They're poorly communicated to the family members. They're lost. They're not accessible. They're faulty, and they can be overridden by family members. Family members themselves often suffer from a number of different things here. Treatment could be inconsistent with the patient's actual wish. They can suffer from financial burden due to misinterpretation of documents. They can suffer emotional burden just from the decision-making itself, as it's a very guilt-ridden process. They can see conflict as it occurs between the families over someone's care. For providers, this is a huge safety issue. 80% of the times, living wills get misinterpreted as do not resuscitate orders. That results in an overtreatment issue or an undertreatment issue, and it's not an issue, it's a medical error. And we have to get better at calling the medical errors to improve the process behind them. Physicians themselves receive insufficient training as far as end-of-life discussions, options, and documents and when to follow them. And physicians really from that risk violating that patient's medical wishes, which is very, very concerning, and it's detrimental. They also may not have access to the needed documentation in that time of crisis where it's needed to actually make that decision. And we don't know if they actually come across the documentation, if they will act appropriately. They often get caught, this is huge, they get caught between family members who disagree with the treatment plan. And essentially providers and systems themselves now are at risk for wrongful prolongation of life cases, not just the wrongful death litigation that we've always typically conditioned to learn about. For payers and health systems, this is big because there's lots of confusions over the patient's wish. It inflates costs due to unwanted or prolonged care. Advanced directives we know are not medical orders and need to transition into medical orders, which is the POLST. And POLST documents essentially really to be effective require system-wide coordinated efforts amongst hospitals, EMS, hospices, nursing homes, providers to get it right for patients, to be created right and to get it right for the right care at the right time. Documents themselves are far from being standardized and universally understood. That's a big issue, especially as people traverse the states. And then there's confusion and inaccessible documents that really just expose us all to risk. So we created MIDEO, which is my informed decision on video, to be a safe solution for patients, providers, families, and the payers. MIDEO is safe in that it provides clarity for the patient. I know medical professionals will now understand my wishes. MIDEO provides comfort in that the family needn't fret over the emotionally charged decision that may need to be made, and confidence that they're confident now that they know their wishes are going to be honored. Because that's typically what I hear in clinical practice all the time. Why do I need that? They're not going to follow it and they're just going to do what they want anyway. For the family members, it provides clarity. It's irrefutable evidence now of the patient's choice. It provides comfort to the family in that it reduces conflict, which is huge among loved ones. It reduces stress among all concerned. It reduces the guilt and unwanted financial burden that occurs because many estates get just demolished by end-of-life care costs and post-acute care costs. And it provides confidence that the wishes now of the loved one will be honored. As we move forward and talk about the safe solution for providers, providers are extremely at risk because of their training. So now they have clear knowledge of the patient's current as well as informed end-of-life wishes. MIDEO is now providing providers comfort that the patient's wishes are actually accessible in real time and easy to understand because it's in their language. And it provides them confidence because now they have the ability to accurately and decisively treat the patient, which has been problematic before. For the healthcare system, the biggest thing amongst healthcare systems and payers is the death panel issues that happened years ago, and no one wants to be viewed as a death panel. So now with MIDEO, they can see clearly a medical order accessible in real time describing a patient's wish in exact medical terminology. Comfort, which is the assurance that members are now going to be safely cared for, so let's get rid of that whole death panel issue. And confidence that they can save billions of dollars and reallocate those by just avoiding things, avoidable admissions, readmissions, extended hospital stays, as well as readmissions to other centers. So this is how MIDEO is going to work. It's guided, and it's a prescription, and it's led by providers that are trained utilizing our triad research methodology and so on. So these are typical documents. These are a living will, and this is a pulse form. And by themselves, they're very confusing, especially in the throes of critical versus end-of-life care. With MIDEO, we can get very clear now. Within seconds now, we can provide information that's on ID cards that is directional, informative, who to contact next. And I challenge all of you here today, while you're on this video, you can take your smartphone and actually scan that QR code. And in less than 15 seconds, you'll get a clear description of what that patient's wishes are in real time that will be able to now guide a treatment decision, which is huge in my world. I'm not going to actually play this video because I want to show you another video. But we often get asked, well, what do you do if a patient's elderly and can't really speak for themselves? Or what do you do if they have a pulse form? And with MIDEO now, we can get really clear with explaining what their intentions are with their pulse form, so we can make sure that patient gets the right care at the right time. And we utilize healthcare agents to actually help make the communication to that next medical provider who's a medical stranger to make sure it's the right care. And this one I'm going to show you here.
This is a resuscitation safety statement for my father, William E. Walker. His birth date is 10/17/1926. His initial resuscitation choice is full and aggressive treatment up until his cardiac arrest. At the time of his cardiac arrest, witnessed or unwitnessed, there's to be no CPR. At that time, you will have permission to turn off his AICD and pacemaker. I am Everett D. Walker, and I am his son and legally appointed healthcare agent. This resuscitation safety statement has been validated by the Institute on Healthcare Directives. Please follow all resuscitation protocols, ATLS, ACLS, sepsis, and stroke resuscitation until cardiac arrest or until we have decided to allow his natural dying process. If he were to develop an end-stage medical condition, despite sound medical treatment, a persistent vegetative state or state of advanced dementia, then please contact me for further treatment direction at 814-434-4364.
So that's MIDEO. And essentially patients then walk around with their cards and essentially have them with their agents as well. And again, they're retrievable in less than 15 seconds. So as I close, I want everybody to think about something. No one really likes change. And change is probably the only thing that's ever really driven revolution as far as healthcare technology and tech in and of itself. You don't really need to go looking through microscopes right now to change this process and make it safer. MIDEO is actually here. It's able to be embraced by multiple different paths, being reimbursed by insurers, and essentially really change and keep patients safe now. Thanks, Michael. Thanks, Silvia.
It's amazing, Fred. Silvia, we might not be able to hear you. But yeah, you can put your question in chat if you want, and I can be your voice while you maybe reboot in, or you can text it to me. But while Silvia is, I know that she does have a question for, I think, Amelia. I wanted to, one, just honor Amelia, Cody, and Fred for being here and for the work that you've done. I think we have really hit before the planning, the critical care piece, and the last chapter piece with MIDEO, and then how we can really honor and memorialize people with 2 or 3 really incredible tools. I would love for people to start filling some of the questions in the Q&A, and I'll ask them to our panelists for sure. One question while I'm waiting for Silvia's question is, I saw something come in, which is, what is PULSED again? Which is, Fred, I'll let you answer that.
That's a medical order, and essentially that's called a physician's order for life-sustaining treatment. Perfect.
And from JMC, do you recommend a do not hospitalize statement? And I would love to hear from Fred and also Silvia on that once we get back.
So I actually do, and we utilize those in more of our end-of-life type videos that we actually prescribe for patients. But yes, we actually do utilize do not transfer orders.
Great. So there's the answer to that. And Silvia has a question which, let's see, she probably to both Cody, I think this is headed towards Cody, because around guardianship. She didn't realize as a foreigner, Silvia's from Uruguay, that if both of her and her husband died, that her daughter would not go to her family. And Cody, maybe you can talk a little bit about the importance of guardianship. I know that you've made it a very simple first step, but also while you're talking about that, I know that I got another question about maybe talking about the emotional impact of trust and wills and what you've seen from people getting prepared and what you've seen on the flip side of people not being prepared.
Yeah, so on guardianship, I mean, as a father now, I think pretty deeply about this, but we rolled out a product called Guardian. It wasn't very obvious in the presentation, but we have a standalone product called Guardian. It's our most affordable product because children are the inciting incident for setting up an estate plan. You talk to wealthy people, you talk to the everyday family that has an estate plan. Why did you set it up? We had kids, and it's usually before they get on a plane without them for the first time, which nobody's doing right now, but pre-pandemic, very, very common. And we wanted to make this product as easy and affordable as possible. It takes less than 5 minutes to do. You're nominating guardians, backup guardians, tertiary. I think you can list up to 4 in there. And as long as that document's signed and notarized, notify loved ones, notify the people that you've appointed as guardians, and we make it as simple as you can. And then very easily you can upgrade to the will or the trust, which is a more comprehensive estate plan package. But we wanted it to not be a barrier, cost or time, to getting your kids taken care of, just in case. Now, the second question is our product. Our customers' ages range from 18 to 2. I don't know what 18-year-olds are setting up an estate plan, but they exist. Common reasons you see kind of 2 demographics: that 30 to 55-year-old parents with minor children oftentimes own a home that are setting up an estate plan for the first time. Or you'll see 55 plus that are setting it up for one of 3 reasons. One is that half of 55 plus doesn't have an estate plan, so they are coming to us to set it up for the first time. The second is to update their plan. Maybe they did it when their kids were born, but it's been 5, 10, 15 years. Their children are now adults. They want to update the estate plan. We do trust restatements, or you can replace your will with us very easily. And then the third is specific to healthcare and the fact that this pandemic, for very obvious reasons, has put a lot of fear in people. And people are coming ultimately to set up the same documents as if they would to protect their assets or their children, but to specify their healthcare wishes and things like do not resuscitate, because they themselves are high risk or they are a caregiver. The growing numbers of caregivers in this country need to be able to make decisions on someone's behalf or be able to access their records. And we see that as a very common use cases as the role of caregivers. So hopefully that answered the second part of the question there, Michael.
It does, and I think Sylvia's back on. Sylvia, did you want to, can we hear you now?
Yes, can you hear me now?
Yep.
Yeah.
Can you hear?
Yeah, I think that you had a question about
Okay.
reaching out to people that aren't native to the U.S. We might have lost.
Exactly, because I came here as a resident.
Okay, we're losing Sylvia a little bit. So Cody, the question is, are you able to? What are your thoughts on reaching out to folks? Yeah, we can't hear you, Sylvia. What are your thoughts on reaching out to folks who, where maybe English is not their primary language, or might just not find out about trust and will via some of the regular avenues?
Yeah, of course. Yeah. So one of our pursuits, and I don't have an exact timeline to this, is to have a Spanish version of TrustMall. We're here in San Diego, California, so we already have cross-border estate planning firms and attorneys. The language would still follow California law in the documents themselves, but to offer it in Spanish, to offer the platform in Spanish, it is a natural progression of our product, considering that if you look at the number of Spanish-speaking individuals in this country, they make up tens of millions of families. And they're not just in the southern states, they're all over. So for us to offer that is something that is absolutely on our roadmap, and we hope to provide soon.
That's great. And then a quick around to everybody, there was a question about what is the model? Are your services subscription, invoice, pay to play, free, freemium? And we'll go to Amelia to start. I'll answer that question first. For EOL, our platform, EOL.community, is free. It's free for providers. It's free for users. And it's there to connect users to providers and to get a plan. But Amelia, how about talk about Saga?
Yeah, so we have 2 different tiers. There's a free tier that has a limited amount of storage. And then there's a paid tier at $99 a year per family. So there's actually only one person needs to pay for the entire family to have access. And that unlocks unlimited storage and some other kind of customization and administrative options. So that tends to be like what when we partner with people, they'll usually want a little bit more control over the kinds of questions they're giving to their clients and things like that. So that's included in that.
Great, thanks, Amelia. And Fernando, tell us how it works in your world.
Sure, be happy to. And ours is actually a story of evolution. You know, there was a time we actually had to have people pay in cash to do what we do. Today, we've been actually very fortunate to keep plugging away, and as billing codes change, just figure out ways to now compliantly bill and train providers to bill actual insurance companies to actually get reimbursed for this. So it really comes down to a copayment, you know, a primary care copayment for the majority. And then with COVID and, you know, what happened with the presidential decrees on telemedicine, essentially now we have patients contacting us in all the states, essentially seeing patients through telemedicine to provide this service, and it's being covered by their insurance. So it's been a good story for us.
That's great. And I also can attest, I went through the process with Fernando, and it was actually quite enjoyable. We had a lovely short chat, and then I now have my own, you know, my MIDEO card, and it took very little time. So I'm a huge fan of it. Cody, do you want to talk about the how it works over in your world?
Yeah, of course. Yeah, I dropped this into the chat for everyone as well, but our products range from $39 to $500, and they're priced for single, so individuals as well as couples. And then that is an upfront price that gets you the final documents. And then we have a small ongoing $12 a year subscription, one to be the digital record holder of all your information. So when you are coming back as life changes, you get married, have kids, buy a home, or dealing with the death or loss of a loved one, you can make those updates at an affordable price point, and you just have to re-sign, notarize, and witness the documents rather than pay the full price again.
Great, it's awesome. And I want to underscore Trust and Will's code for healthcare workers and teachers. And Cody, why don't you, in case people weren't clear on that, why don't you just, it's such a generous offer, you know, and I would love for people on this call to be able to, you know, take advantage of that incredible generosity.
Yeah, so for healthcare professionals, any healthcare professional working in the United States, we offered a free will-based estate plan for the first few months of the pandemic. Over 11,000 took advantage of that offer. We're still offering an exclusive discount, and we have a credentials verification that you enter at checkout to receive an exclusive discount. Now, on the flip side, following up from our Healthcare Heroes initiative, as teachers have gone back in classroom, educators taking care of our children, we saw the same concerns come up 6 months ago, coming up in August and September, fear of creating a classroom environment without an estate plan. So we are offering a free will-based estate plan to teachers for the next several months. And in perpetuity, we're basically looking to create a exclusive model for anybody that is in healthcare, teaching, first responders, military veterans, as a thank you for the work that they do for our country.
Yeah, I think it's extraordinary. So I'm going to thank you for everybody that's listening. And
yeah, it's our pleasure.
Yeah, and so there's a question for Fernando from Silvia. I don't know, do you see it? Do you see it, Fernando? Okay.
I just saw it, yep.
So, do you mind restating it for people in case and then answering?
Yeah, I think she mentioned that she saw it and tried to inform her legal team of it, and they had some questions. So this is great because there's a law review that just came out by SMU Law, and Thaddeus Pope, who's an ethicist, an end-of-life ethicist at a University of Minnesota. And they talked about how video is already being used and how video is already more effective in clarifying disputes in the court systems and everything. So it did a great review on the whole topic. It really stood out as pointing towards MIDEO as being a best practice. And in addition to that, these are signed medical orders. And in the court system, they're going to be upheld. What's going to be upheld, rather, is what the judge feels is going to be most informative as far as the patient's wishes. And at this point in time, we have every belief, and the support from the legal community is going to be that it will be MIDEO or video, as long as it's done in a very descriptive fashion.
Great. So send that ammo over to Silvia so that she can send it to the legal department. Elsa Sawyers had a question for you, Fernando. What about if people change their mind? How easy is it to recreate a MIDEO, and how do you keep it current?
So that's a great point as well. And essentially in our model, we essentially treat you as a patient rather than a client, essentially. So, and you're risk stratified according to your medical conditions. If you're young and healthy, you may not need to see us again for 5 or 10 years. If you got a serious illness, I may want to see you every year. If you're with an end-of-life condition, I may want to see you every 3 to 6 months so we can make sure we adapt and change as you need to. It's very easy to do, and the technology we built today now in the form of apps and controlling consoles, we can provide this service very quickly, timely, and with very high quality to keep people safe.
It's great. Clearly, video is the future. I like that somebody mentioned, commented like, I feel like I'm watching the future. That's what I wanted for people to give a direct portal to the incredible work that's happening once a month. And so there's a great question here from Chanel Reynolds, who I get the honor to work with on the EOL team, but many of you might know Chanel Reynolds as the founder of Get Your Shit Together, which is probably the most utilized end-of-life planning checklist out there. And now she's joined EOL, and so we get to work together all the time. She's got a question for all panelists. Curious to hear how these tools have been able to assist families differently, better during COVID, and I would imagine those learnings are informing your offerings in the future. So I would love to hear from everyone on that.
Sure. Oh, go ahead.
Cool. I'm happy to chime in on that. I would say there are two kind of big behavior changes I think that we've seen from families using Saga. One is certainly, I think, a renewed sense of urgency. We've heard a lot from people saying, you know, I always wanted to do this. It's always kind of been in the back of my mind. I just kind of figured I'd get around to it someday. And I think people realizing that, you know, if they didn't get these things saved, that it might be just a really great regret later. And so just people kind of prioritizing it, I think, as it being important to get some of these memories and kind of pieces of legacy saved. Now, I think also people are finding that they're having more time on their hands now to do that. So that's the second big thing that we've seen is people saying, you know, my parents or my grandparents are at home and they're, you know, kind of losing their minds. They're alone all day. And this is a really great activity for us to do as a family. You know, we all answer the question, you know, every week or whatever. And it's a way for us to stay in touch, even being so far apart. So those are the kind of the two big ones that we've seen.
And Amelia, I wanted to, and for those that are listening, one thing that we don't talk about very often, but I learned from Bruce Feiler, who's the family correspondent for the New York Times. And that's that knowing our family history is actually an indication of wellness and resilience. It's one of the greatest indications of your wellness and your longevity. And we could go into a much deeper conversation, we should, but a lot of that has to do with what's called an oscillating narrative. It gets bad, it gets good, it gets bad. And Saga really is doing that tool. So it's actually creating resilience just by just doing what you're doing every day. So I need
so fascinating. I think I might have seen one of his articles. It was specifically talked about how it builds resilience in children. Oh my gosh, that's very, very interesting.
Yep, I'll connect you to Bruce. He's a friend. So Cody, go for it, and then we'll close with Ferret.
Yeah, I'll be relatively quick. So there was one slide in the presentation that I shared on the digital execution piece of these documents. So digital signature, notary, and storage of the documents. With the pandemic, with emphasis on social distancing, not just TrustMall, but attorneys dealing with their clients wanting to update their documents or create them for the first time, created a friction point, having to go to a bank, go to a UPS store, have a mobile notary come to your home. And what are best practices, especially those first 2 months were pretty scary times. Now I think people are a little more comfortable with how they protect themselves to execute. But we were the first company in US history to do full digital execution in Nevada. Florida will be live in 5 states by end of year. We're projecting 12 states for the next year. We are the catalyst that's following the efforts on digital signatures, remote online notary to push eWills live to more states, if not all 50 states in the next 24 to 36 months. And it took a global pandemic to accelerate these conversations. It's inevitable that every industry heads digital. That's why we're here in this group today with these amazing companies. But I'm really proud that we've been at the forefront of this, to be the first company to do it and to do it at best quality.
Yeah. Fernando, take it away. And there's also a great question from Stephanie. Hi, Stephanie, in the chat as well. Maybe you can knock both those out as we round out our hour together.
Sounds good. So first and foremost, as far as COVID, I go back to what we do as far as with MIDEO. There's clarity, there's comfort, there's confidence. What happened with this pandemic and the restrictions that happen in skilled nursing facilities and hospital systems, with you not being able to go see your family or be involved in your family's care and maybe getting phone calls or maybe a video chat the next day or so on. With MIDEO, patients can speak for themselves now, rather than having someone who's a stranger to them guess on paper of what their wishes are. And family members can still be with their loved ones, essentially advocating for them with their advanced directive documents through video that they couldn't do in paper. So for video and the COVID pandemic, it's been very beneficial and complementary to help keep people safe. As far as the other question in the chat, let's see. Professional informing advanced care planning organization. How can individuals get started? So getting started is pretty easy. If you go to our website at mideocard.com, you can actually see information. You can get basic abilities to actually schedule with us and learn more. Inside the end-of-life community, we built information as far as previous presentations that we've done for other professionals and so on, so people can be informed more. But if they want to get MIDEO quickly, all they need to do is schedule with us through that website, and we'll be able to take care of them through telemedicine as we're training other providers to be able to do this.
Amazing. Well, I believe that Scooter needs to go for a walk. We promised you an hour. I think we've delivered. We've got all the questions. I'm sure we missed some questions. And yes, I imagine that Scooter is in Cody's will. Oh, there we go. Pet guardian, of course. So Silvia, did you want to say something in closing?
I don't know if you're listening to me or not, but yes. I'm sorry, my technology has been bad today. I think all of the three tools are very useful in different ways. End of life is not only experience, like Saga is helping, it's also metrics and quality that these two, MIDEO and the Trust and Will, are offering us as healthcare providers. I'm very excited to learn more and be able to share that with my community here.
Thank you, everyone. Thank you, Silvia. We're going to send an email with links to these three incredible tools, and as well as to the End of Life Center at Cleveland Clinic. And if you want to find them quickly, you can go to eol.community. All three are on our platform, and you can find them there or through their websites. And with that, I'm just going to have Yo-Yo Ma take us out. And there we go. Almost graceful. Thank you, everyone. Thanks for coming. Thank you, Amelia, Cody, Fernando. Everyone stay safe.